I'd like to introduce our guest for today. Dr. Ann Welsh is a clinical psychologist, executive coach, and consultant. Dr. Welsh began her career at Harvard before opening her own practice with a focus on supporting women in STEM, healthcare, and law, and working parents across career sectors. Her coaching brings together research and real-life experiences to hone leadership skills, improve emotional intelligence, and create work-life integration. And I am thrilled to have you here with me today because I have been really looking forward to this conversation.
Great. Well, thank you for having me.
Absolutely. I think this is going to be really great for my own education and also for those who are going to be watching this video. So let's just jump right in. I'll ask you the first question.
Sure.
You have a background in therapy, as people now know based on the introduction.
Yeah.
What drew you from therapy to executive coaching?
It was a bit of the population I think that I work with in some ways. So in my therapy practice, I focus on perinatal mental health. So women who have children and struggle with mental health in various ways. It could be depression or anxiety, but it could just be transitional stuff, which is quite common. And perhaps in part because of the place in the country where I live, a lot of my new moms were also working mothers. And I found that so often some of the stuff that was coming up was workplace stuff that they were dealing with.
Mm.
And I started to explore coaching as a way to help support them differently, in part because it would allow me to access supporting women who maybe weren't coming in for therapy but were still struggling. But also because I thought if I could start working with leaders, maybe I would have some sway to encourage healthier workplaces overall.
Mm.
And that kind of healthy workplace leadership might lead to healthier workplaces. Um, and so it was really a way to kind of have a more multifaceted, multi-pronged approach to supporting this same population.
That makes a lot of sense. Now, there's a lot of talk about the distinction between coaching and therapy in the coaching space. I'm sure you're aware of that.
Yeah.
As someone who actually is both a coach and a therapist, what do you see as the differences between the two?
So I think the reason probably there's so much talk about it is it's not as clear as we might like it to be. I think the very obvious difference is that as a therapist, you can treat diagnosed mental illnesses, and that really should only be done by therapists. As a really easy example, if you're working with someone who has OCD and you're trying to do mindset work with them, you actually could make the OCD worse, right? Like, really, you need to know these mental illnesses and understand how they work and what helps, and kind of leave that to a specialist. Beyond that, I hear a couple definitions that often like simplify it too much. So, one thing you hear a lot is coaching focuses on the future and therapy focuses on the past.
Mhm.
But again, it's not quite that clear, right?
Mhm.
The past is probably showing up in the coaching even as we look towards the future. And therapists can definitely look at the future, right? Therapy can be about setting goals and working towards them.
Right.
The other really common one I'll hear sometimes is that coaching is egalitarian, whereas therapy is a hierarchical doctor-patient relationship. And again, depending on your school of thought in therapy, that might be very untrue. My one of the theories that I was trained in was called person-centered therapy, and the whole idea is that the relationship is equal, and that the client has all of the knowledge and skill sets they need inside of themselves, which is very much like coaching. So I
Mhm.
think the reality is that it's not two separate silos, right? It's actually a Venn diagram, and that the overlap is much, much, much larger than perhaps the very tiny separate stuff. Um, I was reading when I was doing my training and preparing for the ICF exam, people recommended reading Becoming a Coach by Passamore.
Mhm.
And towards the end of the book, he goes into all of these different types of coaching, he calls them, but really they're all schools of therapy, right?
Mhm.
One was cognitive behavioral coaching, one was
Mhm.
psychodynamic coaching. These all kind of originated from therapy. So again, I think that there is, in fact, this huge overlap. So knowing that, when I try to make a distinction, I think it can help to go to the ICF definition, right? So coaching is trying to maximize potential. It's a creative process. It's typically aiming for a goal. I think of therapy as perhaps more emotion focused. There's usually a healing element, and the aim is mental health. Another way I kind of explain it is that what brings you into therapy is usually a place of pain, whereas what brings you into coaching might be a place of wanting more. And then I sometimes give people a visual. So I'm a really metaphorical thinker. I love
Okay.
metaphor. And so, years ago, a client sent me a meme, and I'm sure people have seen it. And it is, two people sitting in a room in chairs, a therapist and a client. And the client has a thought bubble of themselves holding like a messy ball of yarn.
Mm.
And the therapist has a thought bubble of themselves holding the yarn spooled in to a nice ball. And I think that is the therapy process often, right? The client comes in and there's a whole bunch of stuff, and we kind of pull at the threads and figure it out together. We meander, we move into the past, we come back to the present, and we come up with a narrative that helps them make sense of their life, of where they've been, so that they can move forward.
Mm.
Sometimes with coaching, I think the difference is that we just put that ball down. We don't ignore it or say it's unimportant, but we focus on, all right, what if you just don't use that and take some steps forward, right? It's more of a process of following breadcrumbs down a path than it is kind of untangling something from the past.
Wow. Thank you very much for giving such a comprehensive answer to the question. I think this is going to be extremely helpful to coaches, especially newer coaches who really wrestle with this and sometimes even get a little bit anxious about it as to whether they're doing something wrong in having certain conversations with their clients. Now, getting to one of their sources of anxiety, coaches are often taught not to go back into the past of a client. You mentioned that and talk about their childhood. Do you, as a therapist, often do this?
Yes, right. As a therapy, I mean, from day one, when I meet with a client, I will ask them to some extent, I mean, as much as you can in that initial hour,
Mhm.
about their past. And, what when I work with a client as a therapist, we're often looking backwards to
Mhm.
understand patterns and how those patterns developed, right? So I think from a therapy lens, I'm often concerned with helping figure out the why, right?
Mhm.
Why are you doing things the way you're doing them now, so that we can change them? And what feelings that you're having now are in fact being driven by things that happened to you previously?
How has a background in therapy helped you to be a better coach?
I think a lot of ways, right? I think as much as people again try to separate them, I think coaching and therapy are really naturally a good fit for one another. And in
Mhm.
particular, my background is in counseling psychology. So to just more further muddy the waters, perhaps, I'm licensed as a clinical psychologist. That is the licensure, but there are two different ways to get there. One is through a clinical training program, and one is a counseling training program. And counseling training programs are even more naturally aligned with coaching because they are strengths focused. There's a huge vocational piece to them, where we do work and practice and training on career counseling and career assessments and helping people with that piece of their life. So, I think I had that background already that really mapped on well to coaching. But in
Mhm.
terms of general skills that anyone with a therapy background would have, it's, you know, being really well trained in listening actively,
Mhm.
in that process of just sitting with another person and not necessarily trying to fix it, but just trying to listen.
Mhm.
Um, Thinking analytically, understanding the value of some insight, understanding human behavior and just a lot of the different theories around why people behave the way they do. Um, Seeing the client as strong and capable, and then just the relational stuff, right? Forming a good relationship, forming good rapport, all that stuff that's extra important in coaching as well.
So it's something that some coaches might want to know is, are there some common therapeutic techniques that you use as a coach that, and I want to add to the question a little bit, Anne, in that you mentioned the book from Passmore that you had read as you were preparing to go on your coaching journey and the exam and so forth. When I ask, are there therapeutic techniques that you use as a coach? I guess what I'm also getting at is, are these therapeutic techniques that would be okay for coaches to also use without the licensure that you have?
Yeah. I think in terms of those specific ones, they might feel a little broad, but being able to ask an open question, right? That I mean,
Mm.
the things that we are trained at very early on in our coaching are often some of the same things we're trained in very early on as a therapist. Open questions, a good reflection, right? Where you can take the what someone said and summarize it back to them in a way that helps them move forward.
Mhm.
Um, challenging the thought, right? What we kind of think of as mindset work within coaching is very similar to what people would call cognitive behavioral therapy and changing and challenging our thoughts. Um, and then some even more behavioral stuff like asking people to modify or track their behaviors as a way to make changes. Again, that's something we use in therapy and is quite appropriate for coaching.
Perfect. Yeah, and some of the things that you mentioned do resonate with me, and I have talked about with other coaches. As an ICF member, we're supposed to refer a client to therapy when we feel that that would be a better match for them than coaching. How do you deal with it, considering that you're both? Would you refer a client to yourself for therapy as well as coaching, or would you seek to refer them to another therapist? Like how would you handle it?
Yeah, no, I think that's an excellent question. And so the answer is absolutely not. As much as I said they overlap I think in reality,
Mm.
to do my work ethically, I have to put people in one bucket or the other from the beginning,
Oh.
and they stay
Mm.
in that bucket. And part of that is the ethics of being a therapist and the laws and regulations of being a therapist, so that I can't, if I'm seeing someone as a coach and they need a therapist, I'm going to refer them to a trusted colleague for that work. And if I'm
Mm.
seeing someone as a therapist and they want to additionally have a coach, I would refer them out. Where it gets a little tricky in that direction is that there's no reason we can't talk about pretty much any of the things we would do in coaching and therapy, right? Therapy kind of includes this bubble of everything we do in coaching. So it's less likely I'd have to make that referral. We would just keep doing therapy. And then,
Mm.
whereas if I was working with someone as a coach and they needed therapy, I would really have to refer them to someone else.
Ah, okay. So you said something really interesting here, and I want to just pick up on that almost everything that happens in coaching can be done in therapy. So if you wanted to be really technically accurate, you don't necessarily need to refer someone to a coach as a therapist to get additional support. Uh, and the reason that I find that so interesting is because in my space, in the executive coaching space, I think there used to be somewhat of a stigma about getting coaching, that there was this idea that coaches fix people, and I don't need fixing, and so why would I work with a coach? And I think we've started to move pretty significantly away from that misunderstanding of coaching. However, this you might know where I'm going here, in that executives might not necessarily feel comfortable saying, uh, I need a therapist and not a coach, because a therapist can help me in even more ways than a coach could, including what a coach could do. So I think what I really want is a therapist. There may still be some of that stigma associated with that, as opposed to it now being less so as a coach. I hope I've explained that well. And do you think that that might be so?
Yes. Yeah. I mean, and I will get people who say, I want, therapy, but I also have these kind of more businessy things I want to work on. And can you do that? Or can we be talking about, um, interpersonal dynamics at work and how that plays out? And I'll say, sure, right? That, of course, we might talk about that if you're a business owner in your therapy space.
Mhm.
Um, but I do also get the reverse, where I've had people reach out for coaching, and again, within that first 20 minutes, I've been able to say, I think that this sounds a little bit more like that you're looking for therapy, and here's what that would look like, and here's what the differences are. And then they get to choose, yes, I want to work with you, or no, I just want a coach who's going to let me do coaching, and I don't, that I don't want someone to tell me I want therapy, and that's okay too. That's their choice.
Right, right, yeah. But as someone who's educated in both disciplines, you're able to help make the distinction and make a qualified recommendation to them, which they can choose to accept or not.
Right. Right.
Right. Now, we have many coaches who don't have the same education background that you do. And when we talk about areas where they have a little bit of anxiousness or trepidation, it's about when should I advise a client to work with a therapist. So, what advice would you have, and to coaches to know when it's a good idea to refer a client to therapy?
So, I mean, again, I'll start with the really obvious, right? Anytime a client is indicating that there's some sort of risk of harm to themselves or someone else,
Mm,
immediately, I would say stop the coaching session in that moment
mm,
and crisis management and make a referral. That's the really obvious piece. I think with the
right.
less obvious piece, if they bring up that there's a history of a mental illness, right?
Mm,
I can imagine someone saying, "Hey, I'm working on these things," and then 3 or 4 sessions into the coaching, they're like, "Oh, right, I had depression when I was in an undergrad." So then you notice that, right? Maybe they're fine, but you kind of flag that if things look like they're not getting better, if the client looks like they're maybe getting stuck, that this might be someone who's going to need that referral. And then just in general, any sort of signs that might indicate that they are struggling with mental health, whether it is there's a lot of sleep problems, if they're really irritable, if they're moody,
mm,
um, if there's a big change in behavior, right? If this is someone who typically was on time and communicative, all of a sudden starts ghosting or not showing up, um, or showing up intermittently,
mhm.
or if they encounter some sort of traumatic event that you hear about, that's another big indicator that they might need a different kind of support.
So many good examples there that I think we would want to review and really take note of, because I think what you said right at the outset, it as being obvious reasons are fairly clear, but then when it starts to getting down to the lower parts of your list, not as clear. So this is very helpful. I'd like to shift away now from discussion of therapy and coaching, and just talk about your executive coaching practice for a bit, if that's okay.
Sure.
Yeah, so one question that I have, Anne, I know that you've been a working therapist for some time and have moved into the executive coaching space now, and have established your practice. What's been most challenging for you in terms of setting up your executive coaching practice?
For me, it was that I was a therapist and that I had spent so many years,
Mm,
in particular, in private practice. So, I have my own practice for 14 years now, but prior to that, I had worked at Harvard, as you mentioned, but that had been a while. And so most of my contacts were fellow therapists, but I can't use my former patients for referrals. I can't reach out to them and say, "Hey, you want to come do some coaching with me?" Because for them, I am a therapist, and that's a really kind of um, really sacred and protected relationship. And so while they may have been very happy with the services and done really well, and maybe even want to refer me if they knew about it, I can't just shoot them an email and say, "Hey, refer me all your friends to me."
mhm,
So I felt very, very limited in how I was going to let people know. I didn't have the same kind of work network that I think people who are coming out of industry or business or even academia
right.
have, where they can say, "I've already worked with all these people and they can vouch for me."
Yeah, that's very interesting. I hadn't thought about it. I mean, I've known you for some time, but I hadn't really thought about the unique challenges and complexities associated with this sharing what you now do with those whom you know. I mean, obviously you could share with fellow therapists, but probably the
Right.
incidences of referrals from therapists to coaches just not nearly as often for reasons that you mentioned earlier. So
Right.
what have you done to overcome this challenge?
I have had to kind of face my own introverted tendencies and
Mhm.
just get out there and network, which has
Mm.
been certainly a big growing edge for me. I am, you know, as a therapist, I think in part because there's such a high need. I never really had to market. I made a website and I've been full pretty much since I opened my doors. And it was easy. Whereas as a coach, I've had to actively market and seek out relationships. And so I've done it
Mm.
kind of just tried to find a way that works for me. So I am not going to go into a party full of people that I don't know and talk up my services. Like that sounds horrifying to me. But I am finding that it's very comfortable to reach out to people, you know, with a LinkedIn message and say, hey, can we have a virtual coffee? And that 20-minute connection feels better. Perhaps it's a slower way of building my network, but it is a more natural one, and kind of more aligned with who I am. And that's been successful enough, certainly.
Oh, that's good. That's good to know, and I think that's going to also encourage some other members within our network, coaching members within our network, who also would be horrified by walking into a room full of strangers and saying, guess what I do? Yeah,
Right.
and how could I help you to be a more effective leader? Yeah, what challenges are you facing?
Right.
I completely relate to that. That definitely represents some of the challenges that I had. We've both been in business coincidentally in 14 years, and I remember the early days of trying to establish clients and coaching. The last question I have, Anne, is: have you found when you meet people that they are somewhat intrigued or fascinated or impressed by the fact that you are a therapist and an executive coach and then also a consultant as well, that is that in a way more attractive than perhaps just being one of those?
I think probably, I mean, I think it works both for me and against me at times. I think it
Mm.
is, I've certainly had people reach out who have said, I chose you because you have both.
Mhm.
And really wanted that. I have not been able to take on a handful of people who have reached out to me from other states who have said, I want both and I want it, but really what I want is therapy and someone who can do this other piece of work. And I can't do therapy officially outside of Massachusetts where I'm licensed.
Oh.
So occasionally it brings in someone that then can't actually do what they want. They can only do coaching with me if they're out of this state.
Mhm.
Um, and you know, I would say that there are those who to whom it appeals, and there are also people that say, well, you haven't worked as a, you know, you haven't been a CEO of a company or what have you, and so I assume you're not able to coach me for that reason. Um, and I think in that case, it's often people that don't fully understand what coaching is, right?
Mhm.
As we all
Yes.
learn when we go through the training program. And so
Mhm.
either there can be some education if they're willing to talk to me about it, or they just don't contact me, and that's kind of, there's not much I can do about that.
Yeah, it's really interesting what you mentioned about the fact that you can't provide your therapeutic services outside of state lines, whereas as a coach, I have clients around the country and even around the
Right.
world without reservation or any legal issues associated with that. So there's another distinction between therapy and coaching in that we are not restricted as to our geography. But
Right.
of course, we're in a different profession, and it speaks to that. Wonderful. Well, this has been really interesting, and I've been looking forward to speaking with you and asking you these questions that have been on my mind as well as the minds of many coaches for years, literally. I'm grateful for the time that you spent with me today to help coaches to understand these questions and also just get to know you a little bit more. So thank you very much.
Of course, of course. And I, you know, I find this overlap really interesting. I think that there's a lot to, you know, I could talk about the differences and the similarities for hours, but if people are curious and have more questions, they're also always welcome to reach out. As I said, I like doing the one-on-one connection, so I'm
Mhm.
happy to get a virtual coffee or something if people want to talk about it more.
Oh, thank you very much. That's a generous offer, and I suspect that after watching this interview, you'll receive a few inquiries about that.
Great.
All right. Well, thanks again, Anne. It was a pleasure being with you today.
Thank you.